Welcome back and good day. In this episode number 8, I'm going to be following up on the concept of healthcare imperatives, but diving into how they rely on or our ability to deliver on those healthcare imperatives is a function of underlying clinical processes and so-called information assets. We're going to spend most of our time focusing in on 3 types of information assets. Something I'll call traditional IT assets, the Internet of Medical Things and biomedical devices as a second category, and the last category will be the Internet of Things in general. The point is this: if we're going to have a shot at delivering on those imperatives, quality of care, access to care, and timely care, we're going to need to assure these important underlying processes and assets. As a quick reminder of where we are in our journey, please take a look at the slide I'm exhibiting now. We're in episode number 8. I plan to record a total of 30 episodes. All of the episodes will be posted on this YouTube channel. If you haven't already done so, you may wish to subscribe so you're notified of new postings. Please feel free to provide any feedback. And last but not least, if you have any friends or colleagues whom you believe will benefit from this series of episodes, please share the YouTube channel link with them. Allow me to build this slide out. The imperatives about which we have spoken, quality of care, access to care, and timely care, depend on clinical processes and underlying information assets. In general, think of an asset as a major application, a general support system. It might include a major program or initiative you have underway. It may include traditional IT assets, as I've exhibited on this slide, physical plant, personnel. All of these assets come together and enable our ability to deliver whatever services that we're charged to deliver. In healthcare, consider these categories that are shown. Traditional IT assets, for example, the EHR application, clinical systems, it might be patient billing, patient accounting, quote-unquote traditional IT assets. In the second category, the Internet of Medical Things, take a look at some of the devices that I've mentioned there. Patient monitoring devices, implantable devices. It might be blood refrigeration units as another example. And then last but not least is the category of so-called IoT assets. These, of course, may or may not be biomedical in nature. It might be part of your building management system. IoT assets might be part of your HVAC system, as an example. Importantly, the Office for Civil Rights defines the information assets that must be included in your enterprise cyber risk management program. Allow me to read from 3 OCR corrective action plans where I think you'll see they define information assets that must be included in the scope of your enterprise cyber risk management program very broadly. So, for example, all electronic equipment, data systems, programs, and applications controlled, administered, owned, or shared by an organization. That's one. Another one. All electronic equipment, data systems, and applications that contain or store EPHI. And finally, all of its facilities, electronic equipment, data systems, and applications that contain or store EPHI. The rule of thumb that we've adopted as we've worked with hundreds of clients is for them to think about all of the information categories or types that I'm showing on this slide, but think about them in the following way. In all lines of business, in all facilities, in all locations that comprise your enterprise, they should be included in your risk analysis. At a Clearwater event, which I hosted in 2019, among other points, Nick Heasters, who's a health information privacy and security specialist at the Office for Civil Rights, made the point that all meets all. When we get deeper into the concept of an OCR quality risk analysis, we'll probe this a little bit further and come back to the importance of all meets all.
Right, and I just want to make a couple points. Before the safeguards section of the security rule, there are what's called the general rules. And the general rules apply to the standards and the specifications, within the security rule in the safeguard sections. And the first general rule says that entities covered by HIPAA are required to ensure the confidentiality, integrity, and availability of all the EPHI those entities create, receive, maintain, and transmit. And as far as how the security rules applied, how the risk analysis conducted, all means all. All does not mean the EPHI in your EHR system. It does not mean the EPHI within your practice management system. It means the PST file that contains EPHI that's on your CEO's iPhone. Within their system there. It means that the spreadsheet that your researchers are doing or doctors are doing for some kind of other research that contain clinical information or what have you on our laptop they take home every day. Or billing information that your biller takes home on a laptop to work from home. You really need to consider where EPHI is within your environment, how that information, that EPHI is going to be created within your environment, what those ingress points are, how that EPHI is going to flow within your environment through different touch points, different departments, different individuals, and how it's going to leave your environment. What are the egress points for that EPHI? And what are the risks to the EPHI throughout that process? And to ensure that those risks are appropriately mitigated.
Yes, there are a lot of words on this slide, one of my least favorite types of slide, but here's the point. It's a small snippet of some of the comments that were made in Office for Civil Rights corrective action plans or in the settlement agreements. Look at some of the bolded statements. Number one, as part of this process, SSS shall develop a complete inventory of all electronic equipment, data, and systems and applications that contain or store EPHI, which will then be incorporated into the risk analysis. Next one, SJH, St. Joseph Health, shall develop a complete inventory of all electronic equipment, data systems, and applications that contain or store EPHI, which will be incorporated into its risk analysis. Sounds a little redundant. Finally, the last one. Prior to conducting the risk analysis, Advocate shall develop a complete inventory of all of its facilities, electronic equipment, data systems, and applications that contain or store EPHI that will be incorporated into its risk analysis. And by the way, you would be amazed at how many assets are missed when organizations develop initially this inventory. Blood refrigeration units. You might be going, wait a minute. They don't create, receive, maintain, or transmit EPHI. On the other hand, they're a secondary or downstream information asset that could adversely affect an upstream patient in some way. Closed-circuit TV, voice systems, digital cameras, paperwork that's left around that's not included in the risk analysis. That just gives you a sample of some of the things that are left out. But more importantly on this slide, OCR cares about great comprehensiveness when it comes to these so-called information assets. And finally, to wrap up, what we covered in this session was the concept that without care and attention to underlying processes and information assets, we're never going to be able to deliver on the healthcare imperatives that we discussed in the last episode. We specifically talked about traditional IT assets. We talked about the Internet of Medical Things and biomedical devices. We also spoke about the Internet of Things in general. The punchline is that delivering on those healthcare imperatives depends very much on ultimately assuring these information assets. We'll get back to that. As always, I'm ending the session with a combination of actions and resources and references. While the material is still fresh in your mind, I encourage you to consider undertaking some of the actions and certainly consult with some of the references and resources that are provided. In the next session, we're going to continue in this journey of information assets and their importance to healthcare delivery imperatives. But now we're getting to the point of what does assurance really constitute? We're going to come back to something we covered at the very beginning, and assurance at the end of the day is going to be about three things: confidentiality, integrity, and availability. And so that wraps things up for today. Thank you again for being with me, and we'll see you in the next session.